motion. Motion.
I also have a handout. Oh, there it goes. If I could approach. I wanted to bring to your attention that on this Wednesday, September 10th, is the World Suicide Prevention Awareness Day. And we will be doing an activity at Lifeways, and we're trying to get other stakeholders in the community and businesses actually to support the movement in regards to awareness and prevention. And what will be happening is between 12 and 1, people will be wearing yellow and white and lining up along West Avenue there in front of Lifeways, as well as other locations in Jackson, just in memory of potentially somebody that you might have lost to suicide, if you happen to be a survivor of suicide, or just to bring awareness to the community about the impact that suicide has on individuals. After that event, there will also be an open house at Lifeways for the Jackson Suicide Coalition, and that is made up of other stakeholders within the community who are invested in having an impact on reducing suicide. So I just wanted to bring that to your attention. In this packet, I also mentioned about where we are related to Healthy Michigan. At the time of this printing, since then, at that time the report was 95% of Healthy Michigan. We had reached that number for Jackson County. We're actually at 100% now. For Hillsdale County, we're slightly still below at 64%, but we're doing some things working with the Hillsdale Services Network to try to come up with some creative ways to target individuals that would qualify under Healthy Michigan, and one of those is having a booth at their fair. So we're hoping that we'll be able to have as much of an impact in Hillsdale County as we do in Jackson. The other thing I wanted to report on was related to access and where we are with services. It's important, I think, that the county hear about what it is that how we provide related to the number of people coming in for services. In June, we had 501 individuals that came in through our front door, and in June, we had 311. What's important to note is that many individuals that do come in, we are the coordinating. So we will coordinate within the community if they do not qualify for services at Lifeways. And the last 2 months, 84% of those ones that we were able to coordinate it actually followed through with the recommendations at the point of the referral. We do have same-day access at Lifeways. I don't know if you're aware of that, but if you are an individual that meets criteria for services and needs to get connected with services immediately, we provide that same day. We believe that helps with the loss of individuals that leave with an appointment and then don't follow through with that first initial engagement, so that's important. The other thing that's included in your packet is some information related to satisfaction with individuals, because that's been a primary focus of our board over the last year or so, related to improving our customer satisfaction from the community as it relates to accessing services. And you'll see that it has improved. We did 523 total surveys. One of the important things to note is that many individuals that are getting referred are following through. So with the appointments, if it's outside of Lifeways, we check to make sure that that engagement happens. Some of the barriers that people identified when we do refer out, why they do not follow through, is that they lost the slip or just didn't personally make that connection with that organization. So those are things that we're going to be looking at internally to see how we might be able to address those. The other thing that I'd like to point out is related to, they do incentives with the Michigan Department of Community Health. Annually, it's part of our contract, and they look at across the state, they'll award a first and second prize to a community mental health that achieves those incentives. And this year, we did achieve second place statewide for supported employment and did receive $30,000. So I just wanted to bring that to your attention. And then the last thing is I just want to request if the county commissioners could be sure to keep Gerard in your prayers. And that's it for my report.
Thank you. What comments or questions might you have for Mary Beth? Seeing none, thank you for that report.
All right, thank you.
Department on Aging?
Good morning,
Good morning.
and I have with me today our new Deputy Director, Danielle Paquette,
Hello, Danielle.
and she's started out at the Department on Aging as a student intern, and then was hired as a casual to help with a prescription program, to pay prescription costs for older adults, and then she helped write a grant for Alzheimer's respite, and then when the in-home services coordinator position became vacant, then she was hired for that position. So today is her first official day as deputy director, but she still is doing her work as in-home coordinator until we fill that position. So I just wanted you to meet Danielle. If I'm not able to come to a Human Services Committee meeting, she would come in my place and give our report. When did you start with the county? 97? 1996. So, very glad, yeah. Congratulations. Yeah. Medicare annual enrollment period is October 15th through December 7th, and this is a busy time for our Medicare Medicaid Assistance Program, or MAP, volunteers and staff. But we encourage people who have Medicare to look at the coverage that they have, especially their prescription Part D coverage. And for people to get information through our office, they do need to make an appointment. That people walking in, we still give them an appointment so that we see people in the order that they come in contact with us. So again, just encouraging people to please call and make a time to come in and talk with someone. And we will be using the senior computer lab and hopefully the computer lab in the Human Resources building to make appointments with people, to sit down with them and help them navigate the website that's at the Center for Medicare Medicaid Services to look at, okay, what are my options? What are my 3 best options? Which one should I pick? So our volunteers and staff will help people go through that process. And our annual volunteer recognition will be Friday, October 17th at the Human Services Building in the lower level. So if you're available and could come, entertainment's at 11 and lunch will be served at noon. And it's a time for us to celebrate all the volunteer services that we receive from the different individuals in all of our programs. And also we will be honoring our Department on Aging provider, showing our provider appreciation at that event as well. And before I move on to the next item, I just wanted to read a thank you note that we received. It was for one of our staff who we do an in-home visit with people who requesting Meals on Wheels or another in-home services, or maybe they're a caregiver caring for someone at home. And so this note was written to one of our case managers. I just wanted to send a note to thank you for your visit with Mrs. C. She feels more confident now about living at home after her conversation with you. She is enjoying the Meals on Wheels service. I'm kind of skipping ahead. All of the changes are so positive for her, and they stem from your visit. You are knowledgeable, professional, and extremely courteous. Thank you. So that was nice.
Any questions, comments for Marcy regarding the director's report before we look at the bids? All right.
Okay. We have a grant called CHORE, and it helps, we have someone that installs grab bars for safety-related items, but also part of that grant is paying for snow removal, which again is safety-related. So once a year, we ask for requests for quotes, price quotes from different businesses in the county, and you have a list of the ones that responded to our request for information, and the lowest price is Doherty Tree Service for snow removal in the central part of the county, and then for the outer areas of the county, Alpha and Omega, and then for lawn mowing, Deer Run. And we limit lawn mowing depending on how much snow removal we do. For example, this last year, Leslie Krantz coordinates this program. We had 15 snow removal clients. Normally, we'll do 2, maybe 3 snow plowing for the winter. This time, we did 8. It's a recent memory, the winter of last year, and I hear it's going to be another similar one. So that was our priority. So right now, lawn mowing, we have 5 clients that we're providing lawn mowing for. So the motion would be to approve Doherty Tree Service and Alpha and Omega Construction for snow removal and Deer Run for lawn mowing for the years, grant year starting October 1st through
Right.
September 30th, 2015.
A motion to accept those bids as presented?
So move.
Support.
We have a motion and support. Is there any other comments, questions you might have regarding these? I have a question. Sure, Commissioner Leitner.
I see for the Doherty Tree Service, it's within an 8-mile radius of the city. How many of your clients, I guess, are outside of the city, and what is their mileage rate?
They don't charge mileage.
So
It's
they
a
just
flat-
don't do it.
It's a flat rate, correct.
So regardless, you have to hire somebody else if they're outside that city, that 8-mile radius?
And that will be Alpha and Omega Construction. Right. This is the, last year, Doherty Tree Service had the limited within a radius of the city limits. And when we needed service beyond that, we did contact another snow removal service who provided service to someone who the meal driver couldn't get into their house. So we did pay for snow removal. That particular business did not apply to be a regular agreement with us, but this Alpha and Omega Construction did. So a majority are within the center part of the county, but the few that we have outside of the center would be a separate business.
Any other comments or questions for Marcy? All right, the motion has been made and supported. All in favor say aye. Aye. Opposed, the same? Motion passed.
Thank you.
And thank you again, and Danielle, again, welcome to your new position. And thank you for your service. Next on the agenda, we have the Medical Care Facility Quarterly Report. Sandy?
Good morning, Commissioners.
Good morning. I believe today's a day of introductions, is that not true?
It is true, and
Excellent.
I am pleased to introduce our new Director of Nursing, Deborah Heath. She's been with us about a month now, but she's already had a very impactful month with us, making positive changes. Deborah comes with a wealth of experience both as a nursing leader and in person-directed care. So we're very excited. The nursing teams have accepted her with open arms, and we are extremely grateful to have her. You're welcome. You are in receipt of my report. The first area is finance. We are 58 days out for our AR, which is both a manageable and acceptable number. Our census is slowly rising until last weekend. We had several people go home. We have struggled reaching our 51,000 Medicaid days this year, which will cause a larger bed tax for us and essentially reduce our Medicaid rate for next year. We're continually monitoring staff census to overtime. All of our financials, bank statements, AP processing, AR, and financial issues and concerns have been reviewed and appropriately acted on. A very significant number for all nursing homes now are hospital return rates, and we are consistently below state and national averages, so we're very proud of that. And we continue to partner with Allegiance. JCMCF under People continues to work to build our nursing casual pool, which will also reduce our overtime. Various evaluations have been completed in the last quarter for managers and directors timely. Our employee support policy went into effect September 1st, and this is in an effort to teach people both better money management skills, life skills, along with provide a possibility for supports as needed. Union negotiations continue with AFSCME 139 and 2098, but they're almost done. We're very, very close to being completed. We continue the residency program with the University of Michigan through Allegiance Hospital. This is a very, very prestigious thing for our facility to have, and we continue bringing the residents through. Residents, again, voiced no major concerns in the last resident council meeting, or last 3 resident council meetings. Service, we continue to work with regional and county emergency planning groups and expand our capabilities in emergency situations. We have a couple step 2 grievances. One is being arbitrated or will move forward in that process. The other we don't know of as of this writing, if it will. Our strategic planning will be in October, and we will continue to work on plans for what we're going to do with Joey's and respite. Newsletters continue to go out on time, and we did generate a new Facebook page that is strictly for our care partners to exchange shifts. That has worked out extremely well. They're able to meet their personal needs as well as us meeting the needs at the facility by being able to exchange shifts, and that's worked out really well. It was very innovative. It was actually designed by one of our care partners that's a CNA. Under quality, the policy and procedure team met for routine policy review, got all of our needed policy updates to date. Incident and accident reports were reviewed for residents, care partners, and visitors, and were trended and patterned all the data and looked at any possibilities for improvement. The next bullet is an error. I wish it weren't, but it is. We currently are clear of all complaint surveys, but we're waiting for a revisit on our annual. We're continually reviewing our quality statistics and comparing our outcomes to state and national averages. We score better on numerous areas, antipsychotic medication use, pressure ulcers, turnover, and hospital readmissions. They're all major areas for long-term care. And under growth, we continue to look at ways to use the space for Joey's and respite. Any questions?
Thank you. What comments or questions might you have for Ms. Place? Seeing none, we'd like to thank you for that report.
Thank you very much.
Next on the agenda, we have DHS, Zoe Lyons, Director.
Good morning.
Good morning.
I just wanted to share a few things in addition to the written report that I submitted. With regard to the Healthy Michigan Plan, just a bit of an update as Mary Beth reported with the LifeWays report. She actually gave you a little bit more than I even have in my report, which is that Jackson County was at 100% currently, so that's great. We continue to receive applications through the federal portal, which we call the cloud. So we are still getting some applications through the federal application process. Jackson County DHS went live with electronic data management, which means that all of our files through the cash assistance and food stamp program are now electronic. So we're not taking paper anymore. Any paper that comes into our office is now scanned and put right into our computer system, and we are filing away all paper that will eventually be shredded. Anything that is mailed in is now being mailed directly to Lansing and is being scanned and processed in Lansing. What I want to let you know as a result of these central scanning is that there are some delays. So if you happen to hear from some of your constituents about delays, what is happening with the delays is that sometimes cases are closing because the system will close something automatically if we do not get the paperwork on time. However, as soon as we get the paperwork, then we're reopening the case. There's no lapse, there's no benefit change. The client gets all their benefits, and it's a couple of days difference. We are letting all of our caseworkers know if they get calls, just to inform the client that we will open it as soon as we get the paperwork. So it's a couple of days difference, but sometimes our clients are getting a letter in those couple of days that is saying that their cases are closing. So, we just want to let you know that in case you get calls. And if there's any difficulties, you can call me and we'll make sure that we get that information out. In addition, with regard to child care fund expenditures, we are on track to be within our budget. We did do an amendment to change some line items last week, but we are on track and we will not be asking for any additional expenditures at this time. I did want to make a correction to the first bullet in our meetings. The Human Services, it's actually Coordinating Alliance here in Jackson. It's a Human Services Collaborative Body, but it is the Coordinating Alliance. And then one last update in Jackson County with regard to adult services at Jackson County DHS. We've just been notified that our adult services program is going to be moved under a regional structure in the upcoming probably month or two. So the programs of adult community placement, independent living services for adults, and adult protective services is going to be moved under what we call our business service center. The physical adult services workers are going to stay at Jackson County Department of Human Services, but they are going to have a reporting structure that no longer comes up through me as the Jackson County DHS director. It's going to go to a different business service center. So that's going to happen before the next quarterly meeting. You may or may not hear about that in the community, but I wanted to make sure that you were aware of it. If there's any issues with that, I will let you know at the next quarterly meeting and just keep you apprised of it. And that's all. Any questions?
Zoe, would you please make reference to the issue of the number of enrollees on the Healthy Michigan Plan and the male population of Department of Corrections and how that is affecting us here at the county, in Jackson County?
Well, what would you like to know?
Well, I think for the sake of the board, I mean, when I attend your meetings, I found it very interesting and was not aware that how the enrollment procedure takes place
So-
with the male population of our
The
DOC.
Yes, because the prison is within Jackson County, any of the prisoners at the Jackson County Prison can apply for the Healthy Michigan plan. They will apply here in Jackson County, and then their case will be opened by the staff here in Jackson County, their open case then would be transferred to the county from which they came, where they were sentenced. So it will be, it's a significant amount of work for my staff here in Jackson County initially, and then once the case is open, it sort of gets spread out amongst the state. But initially, it's a significant amount of work for the staff here.
And your staff is able to maintain that additional responsibility?
We're still evaluating that,
Okay.
yes. And the prison we talked with some folks at the prison about how best to do that. Right now, the prison, I believe, has hired some additional staff to help the prisoners apply on the computer. But completing the application process is just one piece, and then actually completing the approval process is another.
Commissioner Shotwell?
Does that mean that our population within our jail could apply for services through your office also?
It does. And we have met with the sheriff and some of his staff to talk about
Several
getting that
times.
completed as well.
And our own health department as well has been involved in the conversation, so.
Yes.
So then there would be a direct reduction in county costs for health care for inmates if we get them into enrolled, correct?
Correct.
Significant, and it has been brought up as last month's meeting, I believe, some of the numbers and such were out there. So
Yes.
we've been looking into this for several months.
Yes.
No, length of, yes, it is. There's a minimum amount of days that they have to be in place, but everyone
I
is
believe
working,
it's-
and maybe even when Director Toon comes up, he will have insight as well from the health department, but it is a conversation that everyone's been looking at.
And I
Is
believe
it
it's 30 days.
30 days, I
It's-
believe.
Yes. Yes. So it's not a significant amount of time.
And I think the biggest savings I recall reading are in the prescriptions, the prescription savings as well to the county, the medical piece of it,
Yeah.
so. All right, thank you. What other questions, comments might you have for Zoe?
Okay.
Thank you.
Thank you.
Welcome, Richard. Health Department, monthly report.
Good morning, Commissioners. I'll highlight a few things from my monthly report. We also are sharing with you this morning our annual report as well, and I'll kind of cover them separately. We do have an item coming to the Personnel and Finance Committee meeting this morning as well on a final transfer and match opportunity with the Jackson Health Plan Corporation. It covered this a little bit in my report to you as well. But this will be the end of the Health Plan Corporation and the ability to match funds from the local level. The MDCH was able to determine they could do one more match for us, and so that's what it's going to look like. We're going to be talking probably in next month's Health Plan Corporation begin a discussion about what to do with assets that may be left over from the plan as a result of closing out enrollment in April of this year. And so we'll keep you informed on the plans, the Board of Directors' deliberations about that. But ultimately, we want to continue to use those funds for health improvement purposes here in Jackson County. We've been making some pretty good progress on population health measures with Allegiance Health, and I know you haven't seen the actual documents related to this. It's a little bit complicated, but I'll summarize very quickly that what we're trying to do is to align, or at least upfront, determine how much alignment there is between the quality measures of the Jackson Health Network, clinically integrated network, and what we would call in public health, the population health measures for the community. And what we're using as the background set of measures for that is Michigan's critical health indicators from 2011. They'll probably get updated sometime in the relatively near future, but the bottom line is there are about 40 of these indicators, and so far we've identified about 28 of them that we can align with what the Jackson Health Network is doing. So just for quick snapshot purposes, understand that is relatively subjective in nature, but what we've been able to figure out is that we have about a 50 to 60% alignment between the quality measures of the network and Michigan's critical health indicators. So a whole lot more work would need to be done to create additional measures, if you will, that we'd want to see put in place, but that's all going to take time and it has to be processed through the network as well. So it's moving forward, I think, as fast as we can make it happen. We've had some staff changes taking place in our STD clinic. We have completed the interviews for the part-time additional PHN that will be working in the STD clinic, and we should be making a decision on that shortly. We're continuing to recruit for the part-time position in our MIHP program. We had a very successful participation in the Jackson County Fair with our STD and clinic staff providing community outreach. Julie and I have talked about that in a little more detail, and we got some ideas to expand that even a bit more next year, and the staff were very excited to have been able to participate in it. They got a lot of questions and inquiries from the staff that work the carnival and the festival rides, if you will, about how they access care. And that is an interesting and unique population that is very, very mobile, and we want to try to do something for them at least when they're here in Jackson County. We're working on having more conversation, if you will, about creating I guess what I would call an immunization action coalition here in Jackson County. We participated in the Flu and Immunization Forum with Allegiance Health for many years, but we'd like to have more conversation about how we expand that and look at a broader array of vaccine-preventable diseases and vaccines in the community. So Angela Vitito, our Director of Personal and Preventive Health Services, is heading up that and having that conversation with the forum over at Allegiance Health. It is getting very close to influenza vaccination opportunity time, if you will. We haven't quite received our vaccine yet. We will get it this month in September, and once we receive it, we'll schedule clinics both for the public and for county employees beginning probably late September, first part of October. The co-medical director, Dr. Don Lorenchuk, and I attended a recent superintendent's meeting in August, just before school started. We've had some overall pretty good success in terms of the required communicable disease reporting that is required by the Public Health Code for schools, but we have a few areas here and there in the community that weren't reporting on a weekly basis, so we went to refresh all the superintendents, in particular with at least one superintendent new in the community, Dr. Jeff Beal. We wanted to make sure we connected with him, and so we're also recognizing that we need to use technology to maximize efficiency in terms of how the schools can report to us too. So we're creating an actual online reporting system for the school districts, which we're really excited about, and we think that's going to be a very good additional item for how they can report to us. We did have, and I neglected to report this back in, well, actually we had a maternal and child health block grant site visit that took place in February, but we only recently got the report, so that's probably why I didn't remember to mention it to all of you. But it was a programmatic and fiscal review of programs using those funds from the MCH block grant, and we were satisfied and satisfactory in all respects with that. And of course, it's that time of year again when we're reapplying for the MCH block grant as well for fiscal year 2015. We are going to be an application agency for secondary prevention initiatives related to child abuse and neglect. We did have this kind of a grant a number of years ago that used parents as teachers to reach out to at-risk families in the community, and we'll be able to meld both our parents as teachers effort with the Early On program, which also serves a number of at-risk families as well. So we're really hoping that we'll be successful with that grant application. It could provide up to $50,000 per year if we're successful. The Great Start Early Childhood Programming allocation that we apply for is really kind of an ongoing grant that we get from the Great Start Collaborative, and just an FYI that we've applied for that again this fall. We should learn something very soon. The application deadline was September 3rd. In health education and health promotion, we're continuing to, we we did bid up our full-time administrative clerk position, and what we've decided that will work best for us with respect to that position and support for the Hearing and Vision program is to actually combine 2 part-time positions into one to give us staffing stability. We'll talk more about that in the Personnel and Finance Committee meeting a little bit later today. We are having our WIC program management evaluation take place starting this morning. That is underway, and it's equivalent to our accreditation review, if you will, of the WIC program. So this is a big deal for us at the Health Department, and we'll be meeting with the reviewer all week this week. We did complete the Health Impact Assessment grant funding opportunity and submitted that to the National Association of City and County Health Officials. Unfortunately, we weren't selected. There was a lot of competition for that grant, but it does come out pretty much on an annual basis, and there probably are only half a dozen grants that might be available in any given year. So we'll continue to apply for that in the future because we want to build our capacity locally to do this kind of work. Really good news. Last year, we received 2 different funding streams for childhood lead poisoning prevention program funding. They were both 75, one was 7,500, one was 20,000, and we were notified recently we're going to be able to continue those funds and that effort into fiscal year 2015, so we're really happy about that. The Household Hazardous Waste Collection event is on schedule, and the flyer is available. I'm not sure if everybody received it here yet or not. I want to make sure that you
I
do.
don't believe so, and Commissioner Duckham was requesting that earlier at our 8
Okay.
o'clock appointment also, and the number to contact to schedule the appointment.
Yeah, I'll
Thank
get
you.
that to you. But it is September 27th.
Speaking of making appointments, if you have just one can of something, you need to make an appointment, you can't just stop in?
Apparently, that's the way it's been run in the past, yes,
Okay, thanks.
as far as I know. Yep.
I have a question on another topic. The respiratory virus that's going around central part of the United States, have we had any that's affecting the young people? Have we had any incidents of that in Jackson County?
Yeah, it's a good question. I've been monitoring those reports as well, and we haven't really received anything specific here from the health system about an increase in respiratory illness caused by that human enterovirus number 68. Will it probably get here? Probably. What we do monitor syndromic surveillance, if you will, through the emergency department here at Allegion's Health in partnership with the Michigan Department of Community Health. We haven't really seen anything that matches what's going on with this virus at this point in time, but it, like most viruses, they're pretty easily spread, and if they have it in 10 states at this point in time, the chances are it will also arrive here. Part of our concern with those kinds of viruses, it's being characterized as one of the common cold viruses, and that's in fact what it is. It just seems to be a lot more severe, if you will, right now than what we normally see. And it may also co-occur with the influenza season as well, which I think tends to kind of create the perception among many in the public that, well, gee, I just got over a really nasty respiratory illness. It was probably the flu, when in fact it's not necessarily the flu. So we will be really encouraging people this season to take advantage of the flu shot as well.
Is this like a seasonal virus that it may last until the cold weather sets in, or do you think it'll kind of piggyback onto the flu?
Well, I think it could co-occur with influenza. It just depends on when we might start seeing it in the community. This particular enterovirus is probably well known to the medical community and circulates all the time. For whatever reason, it seems to be popping up as particularly severe this time of this year, and they're unpredictable. Yep. We're also having a fundraiser on September 13th for those of you who are interested in golfing. This is the first annual golf outing for proceeds will benefit the animal shelter. And I think that's pretty much everything I want to talk about in my report. I will make comment concerning your earlier discussion with Zoe about the Healthy Michigan Plan. We did have a couple of meetings with the Sheriff's Department to talk about how this might work in the community, and I think she's correct. My understanding, it matches hers in terms of minimum 30 days to be eligible to apply into the Healthy Michigan Plan by county inmates. So we have offered to help train someone in the sheriff department if they plan to move in the direction of doing enrollment. We do them pretty frequently, but we'd be willing to train someone to help facilitate getting those enrollments done.
All right, thank you. Yeah, and I was reflecting back on our August meeting minutes in your report. In August, you reported of that meeting, so thank
Right.
you for that information, and let the public know that we are on
Yep.
top of pursuing that to the advantage of the taxpayer dollars, so.
You're very welcome. I don't have any other comments concerning my monthly report. Be happy to answer any questions anyone may have.
Comments or questions? Commissioner Plawcheck?
Mine's more of a comment. I don't know if Angela, I'm just looking at my mailing list. I'm the chairman of the Immunization Forum for Allegiance, and I don't see her on our mailing list. We do have a meeting tomorrow at 12. And I see it's still going to Mary Riccadello, so
Okay.
if she can make the meeting, fine. If she can't, I'll make sure that she gets on our list for follow-up meetings.
Thank you. I'm pretty sure she's aware of the meeting. Yep.
Great. If there are no other questions or comments from our director, we'll move on to the next item, which pertains to him as well. We have in front of us a contract with Jackson Health Plan Cooperation for the 2014 period to contract the facilities for one final transfer of local funds to support the payment of final health plan expenses. Upon the motion and second and approval, that will move to the full board. So I'm looking for a motion, please.
Motion to approve.
We have motion and support. What comments or questions might you have for Richard regarding this topic? All right, all in favor, say aye. Aye. Opposed? Motion passed. This will move to the full board as stated.
Thank you.
Thank you, Richard. Next on the agenda, we have MSUE. Matt, welcome.
Good morning.
Good morning. You're not wearing a lot of green and white today, are you, Matt?
No, not today.
No ducks either?
No ducks. It's almost duck season, though. We just didn't catch them early enough. Well, again, good morning. This is our opportunity to give you our semi-annual report for MSU Extension, and this is the form of our annual report, and with the second one that we do of the year, it stands as our annual report for Extension as agreed upon in our memorandum of agreement that we'll discuss a little bit later. So, I just wanted to reiterate our structure. Won't spend a lot of time on it, but you're in District 12 as part of Jackson County, and so that's the 6 counties you see represented in green there. And our 4 institutes are Health and Nutrition, Children and Youth, which is where 4-H resides, Agriculture and Agribusiness, and Greening Michigan, which is Natural Resources, Community Development, and those sorts of programs. These are your extension staff housed here in Jackson County. Some you provide financial support for, some your support is provided through just office space and that sort of thing with them being housed here. So I just want to thank you as a funding partner for MSU Extension and your continued support of our presence here in the county and the work that we do across the state. And we also work with we're a part of the higher ed budget in the state of Michigan and the USDA National Institute of Food and Agriculture. And the one interesting note of that this year is that this was the anniversary of the 100th year since the signing of the Smith-Lever Act, which created Extension nationally, was back in May 8th of 1914. So we celebrated 100 years as an organization this year. So 4-H obviously is one of our cornerstone programs that we operate under. This past year, we've served 461 youth are enrolled in the traditional club-based setting of our programs. There were a total of 2,256 additional youth served in the county. And the exciting part is that we had 40 new Clover Bud members. Clover Buds are those 4-H members that are ages 5 to 8 years old that aren't able to compete in competitive type programs at the fair, but they are allowed to participate in 4-H and a lot of other varieties and opportunities for them. So we're seeing some growth at the new end. That's really encouraging to us. We did have quite a few senior graduates last year from the 4-H program, so our numbers stayed fairly steady year over year. However, the 40 new members at the young ages are encouraging. So 4-H is about life skills and developing life skills. So we focus on all of these different priority areas around, you can see around the wheel there, that we utilize to teach those kids life skills and get them a good start to be good leaders and civic members as they proceed through their education. Of course, we can't do 4-H without the volunteers. We do have about 120 screened volunteers here in the county. We have many more that participate in the 4-H programs and do help to support the work that we do, but we do have 120 official screened volunteers. If you draw your attention to the lower right-hand corner of that slide, you'll see that we're running a new campaign for volunteer recruitment. So if you're watching your Jackson television stations, Lansing television stations in the next couple of weeks, today is one of the days that there's a big blitz on of our media campaign that's running statewide for volunteer recruitment. We hope that will also help us with member recruitment, but we're officially trying to get more volunteers involved in the organization. That's one of our broader organizational goals for 4-H, is to increase our volunteer numbers, increase enrollment overall. So there's a link down at the bottom. I won't go there right now, but there's a link to one of our 30-second spots that you'll see. There's 15 and 30-second. There's also some radio ads and some print campaign things that we're doing statewide to help with our recruitment in the 4-H program. So this just gives you a snapshot of a map of where 4-H clubs are in Jackson County. And so we're always looking to add more if possible. As we need to, as we have volunteers with different interests and areas of expertise, we try to recruit more leaders to be part of those clubs, but this is where we have clubs currently placed in Jackson. Moving on now to agriculture and agribusiness, we still do some youth work in all of our institutes, but agricultural literacy is one of our largest growing areas that we're trying to focus on, because food security is really about awareness, and so one of our main focus areas is trying to bring awareness to those that aren't involved in food production or agriculture, where food comes from, the importance of having agriculture in the country and in the state of Michigan. Michigan is the second most diverse agricultural state in the country, so it's critical that we maintain awareness about that. So we do several programs that will help us with that agricultural literacy. The first is a summer gardening program. We worked in 2 Jackson schools, and I'm not sure which 2 those are. I apologize. I can get you that information if you would like it. But 57 youth learned good gardening skills, and then we tie that to our nutrition program as well. Teach the kids, as well as some of the adults that are present there, how to utilize the vegetables that are produced, because that's one of the things that we found, is that there's a lot of vegetable crops and a lot of fruit crops available that people don't know how to utilize in their diet and don't know what to do with that product once it's harvested. So we try to tie that back to the nutrition and teach them how to utilize those effectively. Rural Education Days, which we do in partnership with Farm Bureau, is another huge program around agricultural literacy. We serve over 1,200 third grade youth from Jackson County schools at this program each year, and again, it's about raising awareness about where their food comes from. Another county-wide program that will be coming up here in a couple of weeks is Family Farm Fest. So I would encourage you to participate in that in some way if you're able to. 11 to 5 on Saturday the 20th. We have more information about details of where those farms are and things at our office, and we have flyers if you want to distribute them to any of your citizens. We'd be happy to get the information to you. And finally, around agricultural literacy is the Breakfast on the Farm program. You may remember we hosted in Jackson a few years ago. We're back around to Washtenaw County again. It was this past Saturday. We didn't quite meet the 3,000 that we expected, but we were close. We had over 2,500 people that attended the event. I think one of the big things that impacted attendance this week was all the high school football games that got rescheduled to Saturday because of the storms on Friday evening. So the one interesting note that I'll make about Breakfast on the Farm this year is not only is it important to the community from an ag literacy standpoint, but it's also an important showing of what community really means. And the farm that hosted this year in Manchester was without power. The storm took out their power, so they were on backup generators. We still provided breakfast for 2,500 people. The Not only did they not have power, but also the field that we were going to do all the parking with, it got significant rain, so we couldn't put cars in it. So we utilized several other businesses in the Manchester area to park. Manchester Schools provided buses so that we could bus everybody from the parking locations to the farm, and that all happened within about 12 hours' notice because the storms obviously hit late in the evening on Friday night, and people were showing up at 8 o'clock Saturday morning for the breakfast on the farm. So it's really just a neat display of what the community can do when they pull together around a common goal. So it was a huge success in spite of the fact that the numbers weren't quite what we wanted, but it was a great opportunity for people to learn more about their community and the farm that was hosting. So some more programs. We still have the gardening hotline that we go through October with that, and then it goes down to just one day a week statewide, but we do host every day a gardening hotline for anyone who has garden-type questions, Master Gardener program. Unfortunately, we were going to start one here in Jackson this week, but we couldn't get enough registrants for that program to run it, so there is one running in Ingham. We'll run one in Washtenaw, and any registrants that wanted to attend the Jackson County program will be able to participate in either of those two when they come up, and we'll do some additional recruitment the next time around for the program here in Jackson. The MSU Product Center, again, is an entrepreneurship, business planning, development tool that people can use for anything food business related. There were 86 counseling sessions here in Jackson County this past year. 17 local entrepreneurs took advantage of those sessions, and 3 new businesses were started. So 3 is not a large number, but it's positive momentum in moving new business into the Jackson community, so we're very fortunate to have the Product Center to be a part of that. One piece that I wanted to draw attention to here is the equine population. We don't talk a lot about that much in our agricultural industry, but it is an important piece of the agricultural industry because of the products that are consumed and the benefit that can have to the economy. If you look at the map here, 75% of the equine population is located south of the thumb. And in this district, we have 4 of the top 5 equine producing counties. Jackson County is 4th in terms of the number of equines statewide based on a survey that was done a number of years ago. And so it's not insignificant part of the economy here in Jackson and surrounding counties. So we do some work. Tom Guthrie is housed here in Jackson, covers those counties, basically works statewide. He developed this new bulletin this past year on rotational grazing for horse owners. He also works in all of the other topic areas listed there on the side, but we do some significant work with that community. On to health and nutrition education. We worked with about 420 adult participants, 239 youth participants on improving nutrition and physical activity. 70% of those showed improvement in one or more of our nutritional practices that we measure as a part of that. We will be bringing on some additional staff through our SNAP federal funding grant with no county funds or no state funds on those, but we will be bringing on some additional staff to provide coverage to Jackson County, so we hope to improve our reach with that program in the coming year. So if you know residents that would be interested in that meet our income requirements for those programs, basically they need to be on food assistance to qualify for that program, certainly send them our way and we'll get them connected to one of our programs. So My Spartan Impacts, we've talked about this I believe before. This is a state site through the university that they're doing through university outreach and engagement to help communities realize the extent of the impact that Michigan State University as a whole, not just Extension, is having on the community. And so there are currently, in District 12, almost 4,000 students that are at MSU that are from the counties in this district. There's over 20,000, almost 21,000 alumni from Michigan State University that reside in District 12. There's currently 17,867 4-H participants. And over $13 million were spent on District 12 businesses in the last year by MSU. So in addition to that, we have over 25 educators providing coverage to Jackson County. You can find a list of those on our website or on the Find an Expert website that we have there at MSU. The catalog that we distributed earlier shows you the breadth of the programs that we offer statewide, and so if there's anything in there that you think would be a benefit to the county, let us know and we will try to bring resources into the community to help provide that program coverage. The bookstore is online where we have all of our publications available. Ask an Expert is a national network of extension educators that can help provide additional assistance if there's something that's emerging or some new issue that we need to address that's maybe been addressed in other states. And if you'll bear with me for just a couple of more minutes, I want to show you this YouTube video briefly, if this will come up here. This is a video that we utilize in extension. We've asked some people to tell us what extension means to them. And I don't know how to do the audio. Let's see. Adam, is there a way I can get sound on this quickly? If not, we can pass on it, but.
Was it power station audio? Okay. That's all low. Sometimes we have a cord that's a little.
Okay. If not, I can, it's fine. It's not critical.
Yeah. Let me check real quick. Okay.
All right, well, while he's looking quickly, this is Doug Lewis. If we don't get a chance to show it, he's a Washtenaw County member, been a 4-H leader for a long time. He gave a great testimony of what extension means to him. There's other available on YouTube. If you search MSU Extension, you can watch the various videos. But Doug's been a 4-H leader for a number of years and just talks about his experience. So it was a good District 12 representation of extension and what we do. Thanks, Adam. So I will let you go to that link on your own. Whoops. So that concludes my report. If anybody has any additional questions about my report, I would be happy to answer those.
Comments or questions for Matt? Am I hearing something? Okay. Matt, before we head to the second piece of information that we need to share with the board, I'd like to share with my colleagues in the audience as well as yourself a document that I got my hands on a couple days ago. The Enterprise Group of Jackson has created a new database, Jackson County Community Data, and it's got agriculture profile on it. I was giving a presentation on regulations and workforce in agriculture, and I wanted to share with you, and I'm really tempted, Dave, to make a competition between you and Sarah, but I'll refrain. It'll be all right. I won't do that. I would if I was in the classroom. Take a guess of how many farms there are in Jackson County. Again, this information is compiled by the Enterprise Group. It's based on the 2012 census. The number of farms in Jackson County, 1,073 farms. Take a guess the total land, number of acres, 183,111 acres. 183,111. The market value of products sold in Jackson County alone, $78,185,000. That's significant. It's very impressive, and you can see the value agriculture brings to our community as well. So I thought that'd be a great tie-in with your next piece there too, Matt.
Yes, absolutely.
So,
Thank you.
next item on the agenda is the MOA Work Plan Agreement. In front of you, you have the plan document to affirm the budget for MSU Extension based on our initial agreement. We have a motion and support. Any comments or questions regarding this document? All in favor say aye. Aye. Opposed? Again, the motion there was to move to the full board. Thank you.
Thank you. I appreciate it.
Next on the agenda, Jackson County Medical Care Facility Retiree Health and Bond Payment. In front of you, you have the resolution authorizing the transfer of up to $257,036.28 from the MOE fund for the bond payment. This motion would move to the full board. Looking for a motion and support before we have discussion?
So moved.
We have a motion and support. Comments or questions regarding this resolution that would move to the full board? Seeing none, all in favor say aye. Aye. Opposed? Passed. And again, that will move to the full board. Next on the agenda, we have claims from August. We have a motion and support to make those claims. All in favor, say aye. Aye. Opposed? Motion passed. Under other meeting minutes, there are none in our document. October reporting schedule, we have the Animal Shelter, we have Community Action Agency, Region 2, Area Agency on Aging, Department on Aging, Health Department, as well as Lifeways. That leads us to our second and final public comment. Is there any public comment? Seeing no public comment, are there any committee member comments? Seeing none, I adjourn to the call of the chair.